Are we good? We're good. We're live. All right.
Okay.
Hello, everybody. I'm Dr. Corey Campbell with Campbell Chiropractic, and I'm here with Jordan Bernard. And Jordan is a nurse practitioner with Optimized Wellness.
Yes.
And we're going to talk about hormones today because last time when we did our first Thursday 2 weeks ago, we had a little intimate group and we didn't Facebook Live it so that way no patients were viewed or seen. So we decided we'd do a little Facebook Live here so that way Jordan could kind of talk to you directly and not have any patients as part of the process. So, like I said, we're going to start and talk about hormones. And I'm going to ask questions to Jordan. We'll go through the process here. So first and foremost, why are hormones so out of balance in today's society?
Well, there's a lot of reasons. So it is natural that your hormones decline as you age. But that age that we found is getting earlier and earlier. And that's pretty much based on diet, lifestyle, how we live, how much sleep we get, the type of food we eat. The possibilities are endless as to why your hormones decrease.
Okay. So my next question then was, has it always been this way? So you kind of answered in that process as saying it has been, but it's happening
sooner.
Earlier in life.
It is happening earlier in life. Plus, we're living later. We're living longer.
Okay.
But we're not necessarily living better. So
quality of life is going
quality of life is decreasing. So as you know, as medicine has improved and gotten better, we've elongated people's lives, but we're not necessarily allowing them to live the fullest extent of their life.
Okay. Very good. So who and how do you know who and why if they're a candidate for hormone replacement?
Yeah, so we have a symptom checklist that people can look at. That's online. That's on our website. And then we also do a simple blood test. And so with that blood panel, we look at all the blood components. We look at liver function, kidney function, thyroid panel, sex hormones, and then vitamin D and B12.
Okay, very good. Cool. So you can figure out if they actually need hormones,
Yes.
want hormones. Have you found anybody so far that didn't need any?
Not a single person.
You haven't found one yet? Good. There was our hormone. Okay. All right. So you kind of went through some of them already. But what are the symptoms? What are the biggest symptoms that people really want help with that will help with the hormone?
Yeah. So the biggest symptoms I see for women, especially, is hot flashes. They're tired all the time. They're unable to lose weight, even though they're doing what they're supposed to be doing. They're dieting. They're exercising. They're eating right. And then brain fog, headaches. Those are the big things for women.
Okay.
Men, you'll see decreased libido. You'll see decreased muscle mass, so their workouts aren't as effective. Decreased vitality and irritability.
Okay. Men get grumpy?
Uh-huh.
What about women? Do women get grumpy?
They can, yeah.
They do.
Yeah.
Come on. All right. So there are different types of hormone replacement therapies out there. So what are the different types of hormone replacement therapies that are out there?
Yeah, so you have kind of two schools of thought. You have bioidentical, and then you have the synthetic hormones as well, so those are different. We believe in bioidentical hormones, obviously, but within the bioidentical realm, there are oral preparations. You can do creams, you can do patches, and then you can do pellets.
So an oral preparation is something that you're going to take a pill on a daily basis.
Yes.
And then a cream is, again, something you're going to put on the skin on a daily basis.
At least once a day, sometimes twice a day.
Sometimes twice a day. Okay. And then you guys do...
So we do the pellets, which are very small, custom compounded hormones for people. And they help with not only relief of symptoms, but they also help prevent age-related illnesses.
Okay. So if somebody has a pellet in the system, what prevents that? Like, for instance, if they take an oral or if they take a cream or whatever, they can limit how much they put on there. But if something's actually implanted into their body, how do they limit how much they're getting?
Yeah, so I'm glad you asked. The body actually regulates that naturally. So since you have hormones available to you whenever you need it, the pellets are cardiac driven. So the more active you are, the more hormones you get, the less active, the less you get. But you're still always going to get that baseline amount of hormones that your body needs to function just on a daily basis.
So if I'm understanding you correctly, what they're actually doing is as the blood goes past...
It encapsulates the pellets.
Okay,
yeah.
So it creates blood around the pellets. So that way when the blood passes by the pellets, it's just picking up a little bit of hormone.
What it needs. Yeah.
So then if somebody's, like you said, it's ran vascularly, so if somebody gets their heart rate up, they get whatever, more blood flow, more hormones actually being picked up from the pellet.
Absolutely.
So the pellet doesn't crumble and fall apart or anything like that.
No.
It's just slowly eaten away.
Yes.
So how long does that pellet last in somebody's body?
So for a woman, it lasts 3 to 4 months. For a man, it lasts 5 to 6.
Okay. Let's see if there's another question. All right. All right. Now, what are the scientific basis for what you're doing versus doing a synthetic hormone?
Yeah, so there's actually over 80 years of research on bioidentical pellets alone, not
Okay.
just bioidentical hormones. That's been much longer. But on pellets alone, there's over 80 years of research of various studies, and those have mostly been done in Europe and Australia.
Okay.
So
that's where they want to, if they want to go search it and look for it, they want to look for studies done outside the U.S. because very little studies have been
pretty
done
much.
in the U.S.
Mm-hmm.
Now, in the process of, let's say, an oral product that they take on a daily basis, do they ever do a comparison on in the digestive tract as it's broken down and absorbed into the body, if they're doing an oral product and it doesn't actually get absorbed into the tissue?
Mm-hmm.
So is that one of the effectiveness differences of?
There is, yeah.
Okay.
Because, yeah, if you don't have a healthy gut, you're not going to break down those oral hormones as well. Plus, with those oral hormones, since they have to pass through the liver, you're going to have, that's where a lot of your negative side effects come from, is from going through the liver.
Okay.
Which you bypass with the pellets.
Okay. So then that's the next question. What are the negative side effects? Or are there any negative side effects of?
The side effects are uncommon, but with any medical treatment, there are risks of side effects.
Mm-hmm.
To put it most simply, basically, the negative side effects, so the side effects of getting too much hormones is actually the same symptoms of it's having not enough. So you'd have irritability, anger, you could have weight gain. Those would be symptoms of too much hormones.
Gotcha. Now, what about, like, we hear about if you have too much or hormone replacement possibly causing cancer and things like that. So where does that come from?
Yeah, so all of that research has actually been done on the synthetic hormones.
Okay.
So the results for the bioidenticals is complete opposite.
So how is a synthetic hormone made versus a bioidentical hormone? So is a synthetic simply a hormone that's made all from chemicals, like it's actually physically created, or is it?
The source is different.
Okay.
So a couple of things. So like the synthetic estrogen is actually sourced from conjugated horse urine.
Okay.
That's where they get it from. It's
Okay.
from pregnant mares, and then they put that in the lab and they make the estrogen.
Okay.
Testosterone, they change one part of the molecule in the testosterone, and that's how they can patent it. And
Okay.
that's why there's a lot of research around that. Whereas
so,
with
it's still not the same.
it's not the same. It is very similar to what's in your body. It is not the same.
That's kind of like the margarine thing.
Yes.
One molecule away from being plastic, right?
Yes.
So it's one of those things that just a little bit of change
Mm-hmm.
is, makes things completely different, but
Yeah.
at the same time.
So the bioidentical hormones are sourced naturally. They come from plants. They're plant-based.
Okay.
And then they put those in the lab, and then they actually make the chemical structure. That's the exact same as what's in your body.
Okay.
But since it is bioidentical, it can't be patented.
Okay.
So we don't have brand names or anything. We just,
So if they're plant-based, could a person eat a whole bunch of those particular plants and actually get their hormones back?
it wouldn't work the same way.
Doesn't work the same way?
No.
Our body doesn't do that?
No.
Doesn't work like that? So much fun.
I know.
Come on. Let's see what else we got. All right. So if somebody goes on the therapy,
Mhm.
what are they going to expect? I mean, we can kind of answer this based on what their symptoms are, but let's go with what is the expected process to going on the therapy? Like you said, you do blood work.
Yes, we do blood work first, and then we have a consultation where I review the blood work and make my recommendations.
Okay.
And if the person decides that they want to go ahead with the pellets, then we do that at the same time,
Okay.
on the same day.
So pellets are already pre-made for them coming into
Yeah, so
that
I
second
have
appointment.
a lot of different doses of pellets, and then how I put those doses together gives the person the individual dose.
Okay. So one person might get 5 pellets, where one person might get 1 or 2 pellets,
Correct.
or something like that. So that varies from person to person.
Yes.
What is are you using are you just injecting those pellets into the body, or?
So it goes on the hip because we want it in a subcutaneous filled area because that's really highly vascular.
Okay.
And so your body can get a lot of blood there. And so we make a very small incision and then we just insert the pellets kind of through a little tube.
Okay. And those pellets you said lasted anywhere from, what, 3 to 4 months for a female and 5 to 6 for a male?
Yep.
In that process, how long before they start to feel changes or differences?
Yeah. So it's individual on the person, obviously, but it takes about 7 days for your body to actually encapsulate the pellets and build blood vessels. So I typically tell patients that they're not going to notice a difference for that first week.
Okay.
And then they will notice a slight improvement over the coming weeks and months.
Okay.
And then they should continue to notice improvements time and time again as they get repelleted.
Okay, so how often, so they last in 3 to 4 and then 5 to 6. So what's the recommendation on the time frame for a repellet or repelleting?
So we do 3.5 months and 5.5 months.
Okay. And then how do you know that it's doing what it needs to be doing besides symptom change?
So at 4 weeks for a man, 6 weeks for a woman, we recheck labs,
Okay.
and that's to make sure that your hormones levels are optimal.
Okay.
Because you might notice symptom resolution, but if your hormone levels aren't at the optimal level, then we still want to take you to that level.
To that next level, yeah.
Mm-hmm.
Now, after doing this for 2 years,
Mm-hmm.
do people come back down on the hormone, or they constantly seem to be going a little bit more, a little bit more, a little bit more?
It just depends on the patient. So
it does vary.
It does vary.
Okay.
If we have patients that make a lot of lifestyle changes, then a lot of times their hormone dose can be decreased
Okay.
over time. But once you lose your hormones, so once a woman goes through menopause, you can't ever get those hormones back, and you will pretty much always have to be on some type of replacement.
Gotcha. So what do men go through when they lose their testosterone? Because we call it menopause for women.
Menopause.
Menopause? Menopause?
Andropause.
Jeez. All kinds of fun stuff going on. So, anything else you want to tell us about? Or let the people know that are watching the video?
Well, just that it never hurts to get a blood test. It never hurts to get evaluated.
Okay.
Just because we do that and do the consultation doesn't necessarily mean that they have to move forward, but we can at least see where they're at.
Okay.
And we haven't, I work with patients every day and they feel amazing on the therapy.
Perfect.
Yeah.
So if people want to find out more,
Mm-hmm.
they don't call my office for it, they call who?
They call Optimize Wellness, or they can go to our website,
Which is Optimize Wellness.
myoptimizewellness.com, or on our Facebook page.
Okay. And now, is Optimize Wellness throughout the U.S. or is Optimize Wellness just something going on here in our?
Yeah, so we're locally owned.
Okay.
We live here, work here.
Okay.
We're in Castle Rock, and then we hope to be expanding into like Lone Tree area.
Okay. So, you guys use one particular product that gets used by other companies too, or are you guys the only ones who use this particular?
So I'm a certified BioT provider.
Okay.
So that means that I had special training from other doctors who specialize in this pellet therapy.
Okay.
And they taught me how to not only do the insertion, but also to manage the hormones.
Yep.
And they have this proprietary dosing site that is really helpful in managing patients.
Perfect.
So that's one of the benefits of going with BioT.
Fantastic. Anything else you want to tell them?
I think we're good.
All right.
Thanks.
Very good. So thanks for joining us. I'm Dr. Corey Campbell. This is Jordan Bernard, nurse practitioner with Optimize Wellness. So give them a call if you want to get your hormones checked out. Thanks. Have a great day.
Thanks.
Good?
Mm-hmm.
All right.